On the eve of the launch of UWIN, universal immunization that would digitally empower millions of children and mothers towards vaccination in India, DD India's Dibendu Mondal spoke to Cynthia McCaffrey, UNICEF India representative, on the benefits this app would provide to millions. Also, how India could become a leading example of technological innovation in the healthcare sector.
After the successful story of COVID, the Indian government is now launching the UWIN portal, which perhaps would be one of the key enabler for universal immunization in India. And to talk more on this, I'm joined by Ms. Cynthia, who is the UNICEF representative to India. Welcome to Doordarshan, ma'am. Your first thoughts on the Indian government launching on the similar lines of COVID, the UWIN portal.
Thank you. This is an example in UNICEF's view of India continuing to build on its leadership and its investment in children. UWIN first is advancing with equity India's children's rights by creating a portal that reaches them, as you said, with universal immunization. It's innovating for impact. UWIN harnesses technology in order to be able to reach in a sustained way at scale.
How do you see at this platform providing opportunities for communities, especially from the marginalized sector, to come up, both for parents as well as for expecting mothers as well as for children? And how do you think this could perhaps be a learning lesson for many countries around the world?
Well, UNICEF is proud that we have been working with India for 75 years. And over those years, we have been learning with and from India. So here is an example of building on India's investment in localizing practical solutions. We've seen that with the Sustainable Development Goals through aspirational districts and blocks. UWIN empowers communities by enabling families to schedule immunizations on their time frame. It there then puts in the hands of the families ownership of their child's health, their immunization schedule, and leads to improving and increasing universal immunization.
How do you think that technology in the medical sector could help develop something like UWIN or in the immunization sector?
I think most importantly is that India is building these technology stacks, and UWIN is one important step focused on universal immunization. It is an opportunity to continue to build on that. And again, the reason it's so important is that it helps to speed up the reach, and it enables India to take it to scale, to reach every child, every family. It becomes a model not just to scale up across India, but globally as well.
Well, of course, technology, leveraging technology in today's world is one of the key aspects in not just in healthcare sector, but across all sectors in India. But thank you so much, Cynthia, for talking to Doordarshan. This is Dibendu Mondal from New Delhi with camera person Vishwavandhu for DD India.